A resurgence of influenza, the 2025 flu season. The 2024 to 2025 flu season has hit the United States with exceptional severity. The Centers for Disease Control and Prevention, or CDC, has classified the season as high severity for all age groups. This level of severity has not been observed since the 2017 to 2018 flu season. The impact of this flu season is significant. In a stark turn of events, influenza has overtaken COVID-19 as the dominant respiratory virus in circulation. This shift in viral dominance is evident in the number of deaths and hospitalizations attributed to each virus. For the first 2 weeks of February 2025, flu-related deaths surpassed those caused by COVID-19. This alarming trend underscores the serious health threat posed by this particular flu season. The high number of cases is reflected in the test positivity rate for influenza, which currently sits at an alarming 31.6% nationwide. Some areas of the country are reporting positivity rates as high as 50%, indicating widespread transmission of the virus. This flu season serves as a stark reminder of the continued threat posed by respiratory viruses. Both influenza A strains, H1N1 and H3N2, are contributing to this season's severity. They are circulating in almost equal proportions, making it more challenging to predict the dominant strain. This co-circulation of strains might also contribute to the overall severity of the season and the range of complications observed. Neurological complications, a growing concern in children. The 2024 to 2025 flu season has been marked by an alarming increase in neurological complications, particularly among children. One particularly concerning complication is acute necrotizing encephalopathy, or AN. ANE is a rare but serious condition that causes brain swelling and tissue death. ANE is particularly devastating in children. It often leads to long-term neurological damage and, in some cases, death. The mortality rate for ANE is approximately 50%, making it a highly lethal complication of influenza infection. The surge in ANE cases is deeply concerning to healthcare professionals. Stanford Medicine, a leading medical institution, has reported a significant increase in ANE cases during the past 2 flu seasons. They have observed between 35 and 40 cases, with the majority occurring during the current season. This rise in ANE cases coincides with the overall increase in flu cases. The exact reasons for the increase in ANE cases are not fully understood. However, it is clear that influenza infection can trigger this severe neurological condition. More research is needed to determine the specific factors that contribute to the development of ANE in the context of influenza infection. Hospitalizations and fatalities, a heavy toll. The 2024 to 2025 flu season has placed a substantial strain on healthcare systems across the United States. The high number of flu cases has led to a surge in hospitalizations, pushing healthcare resources to their limits. As of early February 2025, the flu hospitalization rate was 14.4 per 100,000 people. This rate is higher than the hospitalization rate observed during the Delta wave of the COVID-19 pandemic, highlighting the severity of this flu season. The cumulative flu hospitalization rate for the season has reached 64 per 100,000 people, surpassing the cumulative hospitalization rate for COVID-19, which stands at 44 per 100,000 people. Tragically, this flu season has also resulted in a significant number of fatalities. The CDC has reported 68 pediatric flu deaths so far, with the majority caused by influenza A strains H1N1 and H3N2. These deaths underscore the vulnerability of young children to severe complications from influenza infection. Adults are also experiencing serious complications from influenza. One notable concern is the high rate of methicillin-resistant Staphylococcus aureus, or MRSA, pneumonia in adults with flu. MRSA pneumonia is a severe and potentially life-threatening bacterial infection that can complicate influenza, leading to prolonged hospital stays, increased healthcare costs, and even death. Vaccination and prevention, our best defense. Despite the severity of the 2024 to 2025 flu season, flu vaccination rates remain alarmingly low. Only 44% of both adults and children have received their flu vaccines this season. This is a significant drop from the pre-pandemic vaccination rate for children, which was 58%. This low vaccination rate is particularly concerning, given that most pediatric flu deaths have occurred in unvaccinated children. This tragic statistic highlights the critical role of vaccination in preventing severe flu outcomes, especially in vulnerable populations. The CDC continues to recommend flu vaccination for everyone 6 months of age and older. In addition to vaccination, other preventive measures are crucial in curbing the spread of influenza. These include frequent hand washing with soap and water, wearing masks in crowded or poorly ventilated spaces, and staying home when sick. Early antiviral treatment is also crucial for high-risk individuals who do contract the flu. The severity of the 2024 to 2025 flu season serves as a stark reminder of the importance of vaccination and preventive measures in protecting public health. By increasing vaccination rates and adhering to preventive measures, we can mitigate the impact of influenza and safeguard the health of our communities.